All right, we're coming back. I got to move the camera. Turn up some microphones here. We have Amanda Bolden and Rick Olson with us. I don't know if I can reach the camera from here. I can't, so we're just going to have to do with what we got. If you want to pull in a little, we can get you in the frame.
I'm on camera?
You are on camera.
Oh, no.
You look fine. You're on camera. You're okay. We're good. Camera's good. All right, everybody's up. Let me turn this music off. I'm just gonna stop it. All right, State Representative Amanda Bolden from Manchester, and Rick Olson.
Hi.
How you
One
guys
of the
doing?
Groksters.
One of the Groksters.
I caught him
did.
in the hall.
Yeah, I turned everything back on. You said to put your headphones on and turn on your own microphone, which is the first one. Sorry, go ahead.
I said, hey, I'm going to Granite Grok. You want to go? And he's like, what?
Yeah, somehow I'm not keeping track. It's my own fault.
You dropped your tactical flashlight, I think.
Oh, yes,
Is
I
that
know.
what that is? Did I say the right words?
Tactical flashlight. So,
I'm running in the right circles.
You didn't know we were here? Is that what you were going to say?
well, I kind of did, but I didn't.
Yeah.
It was off the radar screen because I had so much going on today.
Mm-hmm.
It started at 6 a.m. and didn't stop till about 11:30.
That one right there.
This one.
Yes.
Got it. Okay.
Okay.
Let me move this a little further away from the air noises.
busy.
Real busy.
Yeah. Well, that's
Teaching classes, lots of classes.
yeah.
Well, that's good.
That's awesome.
Yeah.
I got to bring my good lady over to get some revolver classes and some basic handling so that she knows how to be really dangerous when the bad guys come calling.
So, welcome to the program. What's new? What's going on? What do you want to talk about? We'll talk about anything.
Well,
Bills,
let's see.
legislation,
Yeah, I
committees.
have two bills.
Excellent.
And they're both about heroin. So in New Hampshire, we've had about a 2,000% increase in heroin overdose deaths since 2010. So something's going on, and people are dying and people are using heroin when before, not long ago, they weren't. And this squirrel is distracting.
That's the whole point.
That's the whole point. Yeah.
So I have two bills. One bill is HB 271. It deregulates a medication called Narcan so that more people can access it. It's a medication that reverses an opiate-induced overdose pretty much instantly. So a lot of people, they're overdosing. That results in decreased breathing, and it only takes about 5 minutes after that starts before brain damage begins. And currently, you can access Narcan through a prescription in New Hampshire and in any other state because it's the federal status. But because of the nature of the medication, it's a little hard to actually attain it because typically the people who want Narcan aren't the people who are going to be consuming it. They're parents, loved ones of people who are at risk of overdosing, who are using and therefore at risk. And also when you need the Narcan, you can't take it because you're unconscious.
Yeah.
So it's a kind of a conundrum for how to actually get this in the hands of people. So
That would be useful, right?
most of the people that
So you're proposing that a parent or loved one would be able to obtain a small quantity, maybe a single dose, at some prescribed time interval.
usually they recommend having 2 doses just in case the first one doesn't work. Because it
It'd be a
depends
lot like
on
having an
how much-
EpiPen.
Yeah.
It is
Yeah.
exactly that.
It is
So you're
exactly
on the right
that.
track, yeah. So that's the whole idea is let's let them have their EpiPens. Because right now when people need Narcan, only the EMTs have it typically. And with that 5-minute window between the
They're not gonna
overdose
be
and the
there.
brain
Mhm.
damage.
Right.
We have a lot of people. I talked to a nurse in Frisbee Hospital who told me, she works in the intensive care unit, and she told me that on average in their unit they have 2 people rotating through there that are on life support and they're going to die. And they're just in intensive care because their families haven't accepted their fate. And so they're on life support, and they're typically uninsured, and all of this. So it comes at a great expense when drug addicts die.
So does
in our
anybody
state.
have any idea why there's so much heroin and heroin use in general? It's just not.
What I've heard is that there's been an uptick in the number of prescriptions for opiates. And this kind of goes back to the war on drugs in general. It's just one nasty cycle. The resistance to marijuana and the benefits of marijuana. I guess no one can hear my air quotes. I don't know.
That's okay. They can
'cause
see
the-
them.
The benefits, they're not widely accepted. And I had some, at first when I heard about medical marijuana, I assumed that it was just a tricky way to get deregulation of marijuana. I thought there's marijuana recreational advocates trying to find a backdoor in, but I read about a lot of studies that showed, wow, this really, like I talked to people who used it, who had tried the opiates that are prescribed for cancer pain, and then they tried the marijuana, and it was a big difference. Like I talked to a woman who told me that she was prescribed, she had a tumor on her neck, she ended up dying. Her son's actually here at the forum. She had a tumor on her neck, and it was incredible pain for her, all the treatments and the cancer itself, and they gave her Oxycontin, and she said that if they dialed it up enough to where she didn't have pain, she would also have really scary hallucinations. And if they dial it down to where she didn't hallucinate, she was still in pain. So that medication was ineffective, but that's all that they would give her. So the refusal to, in this country, to investigate marijuana and its benefits and the fact that you can use it, it offers pain relief, and so I guess there are different chemicals in the plant. So it's not just like you're going to get stoned and eat pizza and watch TV.
Mm-hmm.
You can accomplish
Although you may do that.
different it actually has, I think, some useful benefit, but ignoring it means that this country is relying on opiates.
Mm-hmm.
So that's kind of where it begins, is that, like I have a cousin down in Texas. She's, I think she's in her 50s. She's diabetic. So she's already at risk of one situation in which she could end up unconscious, and that's the diabetes.
Mm-hmm.
And she has back pain, and her doctor prescribed her codeine. And she's been taking codeine for a while, which is an opiate. And recently she went back to the doctor, and she still has back problems, and he wants to give her an additional opiate to take, a different, I think, Oxycontin or something. So he wants her on 2 opiates. That's crazy. That puts her at risk of addiction, number one, but also puts her at risk of overdose. And that's kind of another reason that Narcan needs to be deregulated in the state and made more accessible. Is I'd like to see that when elderly people who are on 12 different pills, who have those little boxes with Sunday, Monday, Tuesday, Wednesday, if they screw something up, if they screwed something up and end up taking way too much of the wrong medication, I'd like for them to already have Narcan in the medicine cabinet at home, and like I want people who have an opiate prescription to also get a prescription for Narcan and go home to their loved ones and say, if you find me unconscious, here's where the Narcan is. I say Narcan, that's the brand name. It's really called naloxone, and it could be in any form. And the legislation is written so that any type of opioid antagonist would fit into this category. So it's not for a specific brand or anything.
Mm-hmm.
So if some kind of dissolvable under the tongue tablet comes out, then it would be just as available.
Are you aware at all of any particular studies that have been done in terms of Narcan? On the other side of the coin, I'll play devil's advocate here for a minute.
Great. I love that.
Narcan, is there a possibility this bill could enable parents to not really face the reality of their, or a family member's reality of a drug addiction that's going to kill that individual? In other words, okay, we got the Narcan, we just got to keep an eye on them. Has there been any discussions about that or any talk about that?
I don't know about how Narcan has affected the availability. I don't know about how the availability of Narcan has affected parents, but I know that among drug users who are trained in how to administer Narcan and who have access to it, typically the first thing that happens is they have higher esteem in their social circle. They're the guy you're the guy that knows how to save lives. And then they develop higher self-esteem on their own and and also because of the education that comes along with being trained to use Narcan, they have a higher awareness about the risks of the activities that they're engaging in. And then in some cases, people even left the scene, like they left their social thing. They stopped using heroin and moved on with their lives. And it was a part of the process of being made, being more risk aware. And I think that with parents, at least the parents that I've been really involved with, a lot of the parents in New Hampshire whose children are either in recovery or have passed away, and all of these people are serious advocates for access to this type of thing. And I don't think that any of those parents want to enable their children. They want Narcan because they're out of options, and their kids, they can't come up with anything else to help them. And definitely in New Hampshire, we have a lack of access to treatment. I think we might be 49th on the list for treatment access.
I think we have a treatment clinic right down here on South Willow. I know that one exists. Several years ago, when
There's
I
a
was-
lot in
Yeah,
Manchester.
we can hear you, Rick.
Several years ago, I was a licensed private investigator. I did civil work, not criminal work. And
So like if my boyfriend pisses me off, I can call you.
no,
Oh, no?
no, I can't afford the insurance.
civil
to be
work mean?
licensed. It means, you get hired by an attorney, that's pursuing a civil action, and you do the investigative component for his. So anyways, the case was, it was a wrongful death suit brought by the estate of a gentleman that was hit by a car from a guy that was leaving one of these clinics. And I was wondering if, I don't know anything about Narcan, and I'm wondering if that has an effect, an altering effect when persons use it. Because he was on he was on Narcan, and he was also on a methadone maintenance, so there was some question of whether or not he was an active user or not.
Narcan is not a maintenance drug, really. I mean, like naloxone can be added to some treatment drugs. I think there's
Right.
Suboxone and it sounds like buprenorphine, but I know it's not that because that's something else. But Suboxone is one I can think of. So there are some drugs that are used. It's kind of like the Advair or whatever they give to alcoholics.
Yeah.
It kind of works in the same way.
Oh,
but that's
yeah.
not what Narcan is.
Antabuse, yes.
Right. That's not what Narcan is. The way that Narcan works, I could give it to you and nothing would happen. So the way that Narcan works, it's an opioid antagonist. All it does is it blocks your opioid receptors.
I see.
It kicks out the opiates. They don't work anymore. They
Right.
can keep floating around in your body, but they can't go to their destination where they are effective. So that's all that it does. It's not intoxicating. There's no potential for abuse. It doesn't do anything else. So that's Narcan is actually used in pretty much every case in the ER. If they have an unconscious person come in who is not breathing and they don't know why they're not breathing, simultaneously what doctors do is they check for insulin level or they check for diabetes while administering Narcan. They do the same thing because they want to determine the cause of the reason that they're not breathing. Because doctors know if they're not breathing, it doesn't matter if his leg's been chewed off by a chupacabra and he's bleeding out, he's not breathing. We can solve the bleeding problem later. If his brain dies, it's all over and none of these other problems matter. That's why it's so important. That's why Narcan matters so much, is because the consequence of an opiate-induced overdose is that you're not breathing.
And are you getting really bad pushback from the opponents? All sorts of scare tactics.
Actually, the state Department of Safety came out and testified in favor. And
I didn't know that.
but I have another bill that's more controversial. If you want me to talk about that.
Real quick, because
But-
it looks like we have some more guests lined up outside.
so busy.
But no, this is great.
The other
please
bill
do.
is very controversial. It's 911 immunity, otherwise known as Good Samaritan legislation. So the way that this works is a lot of, like I said, 300 people died last year of overdose in New Hampshire, and that's a huge upswing from like 15 in 2010. Like it's like all of a sudden something's happening, and obviously people die because they didn't get medical help in time. Period. Whether it's because they're alone or it could be because they're with someone who abandoned them, who realized, crap, the S just hit the fan and this person's dying, and if I call to get the medical help, the police will show up and I'll get arrested for possession or whatever kind of crime they've committed as part of using drugs. So the 911 immunity law that I'm proposing extends immunity to someone if all they're guilty of is possession, then they can't be arrested and for possession, and only if the evidence came out of that specific situation where they called 911 to get someone medical help. And that's because because so many people are dying, because people are afraid to call 911 to get medical help, and they're calling for medical help. They're not calling for an investigation. They already go to great lengths not to involve the police in their lives, and people die alone. I've heard of situations down in Massachusetts. There's a Lieutenant Detective Patrick Glenn. He's the commander of the narcotics unit in Massachusetts and Quincy. And he's been a big help to me because they've had this law down there since 2010. Obviously, though, when you're in New Hampshire and you say Massachusetts did it, people say, well, I don't want it. But So he's been a big help, and he told me that in 2010, before this law passed down there, that they would go to a report of an overdose, and they'd find a guy slumped over in a chair, dead, with a needle in his arm and his ID in his hand, and that was it. People were there. They knew their friend was dying, and they pulled out his identification card so that he could, his body could be ID later, and they bailed. And then they call 911. And when you only have 5 minutes, that means you need to call 911 immediately. You can't waste time cleaning up the scene or getting your car out of the garage or, whatever's going on. So it's insane. And a lot of these people might be users that they were on their way. They already went through a recovery program. They're trying to make their lives better. If they relapse, oftentimes people, their tolerance to the drug goes down, and then but they use the same volume of drug, and they end up overdosing when they relapse. So these people are trying to put their lives back together, and they have one screw up, which, if it were drinking, if it were alcohol or something, maybe you could get over it, but because of the nature of certain drugs, it could be the one that kills you. So we have the potential to save a lot of people and really chip away at the police state.
Sure.
And there's a lot of evidence that shows that.
Well, let me ask you the number question then. So your captain down there, the drug unit in Massachusetts, can give you a body count of maybe 2009, 2010 before the law passed. What's the annual body count since? Are they getting more calls and less bodies?
I didn't ask him about the specific numbers, but I interviewed him, and I supplied the interview to the Criminal Justice Committee in the House here.
Yeah.
And he said that, deaths have gone down and 911 calls have gone up. And he said that overall there's a better dynamic between drug users and the police, where the drug users now see the police as first responders instead of enemies or someone to hide from. And he told me about a particular event where they had some big public event going on in Boston, and there were police everywhere directing traffic and stuff, and someone ran out of an alley to an officer and said, help me, she's overdosing. And the officer ran over and he administered Narcan, because they have a big tax-funded Narcan program down there. That's not what I'm doing. It's just buy it yourself with your own money. Just deregulate it. And he ran over and administered Narcan, and he saved her life. And apparently, when she saw a doctor later, it was very clear, she was very close to death at that point. He saved her life. And in other situations, people wouldn't be willing to approach the police like that. So they're being seen as first responders now. So it has a positive impact, I think, overall.
No, that sounds great. I'm largely in favor of decriminalization, not because I have any interest in taking any of the stuff myself, but because I really think we're wasting a whole lot of money and criminalizing marginal activities as a result of our intense focus on trying to get a few ounces of marijuana off the streets.
Right.
Yeah. And I don't have any problem with decriminalization either, as long as I have an opportunity to go deal with the dealer that sells to my children on my level that I want. Is that not fair? I mean, I'm the parent. I make decisions for my children. So my decision is, until you're 18, you do what I say.
Yeah.
And you're not going to use any drugs.
Yeah.
And then you can make your own independent decisions when you become the age of majority. And I think that is it's not an atypical response.
No,
you know?
no, it's
and
not. So you're
go
saying
ahead,
that
decriminalize them, but if I find somebody selling marijuana to my child, I get to deal with them on the level I choose. Is that not fair?
Oh, absolutely. That, in other words, what you're saying is the health of the
They
drug.
can't hide behind the protections of the law. No assault charges or anything like that. That's only fair, right?
Well,
you
yeah.
have daughters, and
I have a daughter.
yeah,
Yeah. And I
Daughter.
think more to the point, you're decriminalizing use and possession rather than dealing. And what that does then is it shifts the focus onto the sellers, and ultimately you get sponsored outlets, just like you get public houses. Not that I want to see Dutch-style marijuana shops everywhere, but at the same time, if you're going to have the stuff, you'd better be better off having it in a regulated circumstance where the kids can't walk in and get it than in an unregulated circumstance. I can't even believe I'm saying regulated.
yeah.
Well, that is part of the solution. I mean, if you look at prohibition of alcohol, back then people were going blind from, backyard moonshine and stuff like that because they didn't know how much alcohol was
in it.
actually in
Yep.
what they were drinking. And
Well,
today,
not to mention wood alcohol.
huh?
Not to mention
alcohol.
brewing with wood alcohol.
I don't
Yeah.
know what that is.
Methylated spirits, the methyl alcohol, the stuff that makes you go blind.
Yeah.
I just drink box wine. I don't know.
Oh,
Keep it simple. Keep it
It's
simple.
cheap.
Yep. Well, here's
Yeah.
the thing. See, there's always, it doesn't matter whether we're talking alcohol or drugs or cigarettes or scratch tickets, okay? There's always going to be that layer of our society that we have to manage. In other words, you know, there's always going to be people walking around going, oh, look at these people. They're sick and they don't have any money, so, you know, we're passing the hat amongst the taxpayers to pay for their, you know, I call those, you know what I call those people? Burdens, okay? No, it's true, they're burdens, because if money's coming out of my pocket as a taxpayer to subsidize their lack of control, okay, I don't understand why we, all the rest of society at large, should have to pay for that. I didn't sign on to that social contract, so I think that's my only trepidation, and I about legalization of drugs.
Well, you know,
We
Seriously,
talked about.
I don't care what
we
people
actually
do with
had
themselves,
We had
you know.
Matt Simon on, and we talked about decrim of
Yep.
marijuana, and everybody was in agreement that the whole point wasn't so that we would create more people who would rely on us. They would need to take responsibility, A, for their use, and B, for the effects.
Right.
And so there wasn't any effort to make it a
Right.
social.
But in a real
burden.
world, does that happen?
That's the question right
Yes.
there. That's really
It
how
doesn't
it doesn't
happen,
work
man.
that way.
It doesn't happen when you allow liberals to collect taxes to pay to subsidize the people, nor when
Who choose to be irresponsible.
nor when you allow liberals to mandate that the hospitals treat these people for free and charge the rest of us for it.
Exactly.
You have to take those things away. I'm personally in favor of the fact that if you do something stupid that costs a bunch of money, you've got to pay it back. And if you've got to pay it back, well, you have a couple of options, one of which might be the workhouse. Oh, sorry.
Oh, yeah, I can't have that.
All right, we got Aaron coming back in. We want to get him on before we finish the show up today. So thank you so much for coming in and talking to us.
Thanks,
I'm going to stick around.
Okay.
Grok TV.